In today's Ask the Expert segment, we are talking about the uptick in COVID cases and hospitalizations in the U.S. right now. But before we get to the questions, we want to take a look at the latest on the virus. According to the CDC, hospitalizations jumped nearly 19% just last week for a sixth straight week in a row. And newer COVID variants have fueled the rise. All of the new strains are descendants of the Omicron variant, and although new COVID shots from Pfizer, Moderna, and Novavax are slated to roll out in mid-September, which is right around the corner, experts say masking is an important tool people can use to protect themselves as COVID starts to spread at a higher level nationwide. So joining me now is Dr. Frank Lovecchio, an ER and public health physician at Valleywise Health. Dr. Lovecchio, it's great to have you here.
Thanks for having me.
Thank you. Okay, so we talk about these new variants. That is what's also fueling the rise. But what other factors? Because I kind of thought that, we built a stronger immunity to the virus.
When you think about the flu, we develop some immunity to it, but then the next year comes around and then we don't have immunity. So that's one of the things that are happening. And these new variants are very, very resistant. That's what's really worrying us.
But with the flu, you get your annual flu shot. But with COVID, are we looking at even more shots within a year?
Yeah, hopefully it'll settle down and we'll have to get a shot every year. And it's great that you mentioned that the new variant is, the new vaccine is coming out, give or take in September. And I recommend if you can wait for that one, because that's going to try to cover what's happening right now.
Okay, so tell us more about this new vaccine, though. I mean, is it going to knock out, all the germs and everything like that, or is there going to be another vaccine coming out in another 2-3 months again?
Probably the latter. Maybe not 2-3 months, but at least every year or so, it's going to be a new thing. COVID is with us forever, and it's not going to go back to animals. It's not going to go away. And we have a lot of herd immunity, but most of the people that are hospitalized now have not been vaccinated and are older, over 65.
So who should get this vaccine?
Well, personally, I'm going to get it because I'm exposed to it every day at work, and I'm going to get the new one. I'm going to wait for the new one to come out, give or take September, October. But especially older people, especially immunosuppressed. Am I going to recommend my kids get it? They don't want it, and they're like teens. So I understand where they're coming from. They're not going to die from it. It's a very, very bad cold for them. But I say if you're sick, you got to protect me, you got to protect grandparents, etc.
Speaking of protecting, we mentioned a little bit about masks. I was reading that places like Morris Brown College in Atlanta, they issued a 2-week mask mandate. Also, Hollywood studio Lionsgate, they required their employees to mask up for a brief amount of time. Do you think it could get so bad that we have to go back to those mandatory mask days?
Mandatory is going to be tough because I don't think people in Arizona would tolerate that. And the only people that would tolerate it maybe is people in the hospital. And we don't wear masks all the time now. So I think we're kind of tired of it too. So it is tough. And I think that if you do wear a mask, you got to wear a good mask, an N95 mask.
Okay. All right. We appreciate your time, Dr. Frank Lovecchio. Thank you so much. And have a good weekend coming up too, as well.
Thank you, Tram.